Welcome to No Room for Phonies, episode 160.
Wow.
So today we're doing something that we've been talking about doing for a long time. It's been several months in the making, trying to make this particular episode happen, but we're going to begin to talk about our new focus in our house, which is called Rise and Restore Coaching. And so we thought that it would be the best to start with the story behind Rise and Restore Coaching. And then at our next episode on May 30th, we're going to actually talk more about what the coaching is and
exactly.
how it can support possibly you or someone that you love.
Mm-hmm.
So
I want to start this episode somewhere specific, not with the diagnosis, nor with the PSA numbers, not with the surgery date. I want to start with the morning the catheter came out. I was officially cancer-free. The surgery had gone well. Pam and Sebastian were driving me home, and we stopped at a coffee shop. At the hospital, I had put on the pad they had advised me to bring for the catheter removal, and we started the hour-long drive home. We stopped at a coffee shop partway home. I went to the washroom there and stood at the urinal to take out the pad and realized that was a bad choice. I was leaking into the pad steadily. So I moved to the stall and sat down so that I could change the pad and keep my clothes clean. I stood up and pulled on the clean pad, underwear and pants, and finished doing up my zipper, and I remember feeling the leak continuing. And I remember walking out to get back in the car thinking, I don't know whose body this is.
I just remember that day was pouring rain. It was cold.
Right.
It was September, like late September, so that's not 100% surprising. But I was waiting in the coffee shop for him to finish, and I knew just by looking at his face when he came out that it wasn't good. And I knew that it wasn't going to be good, and the whole removal of the catheter was not good at the hospital. The resident was very rushed. I was really upset. Actually called back to the hospital to say how upsetting it was. And I mean, I had kind of been holding things together for a while. I had been researching surgeons and reading recovery forums and trying to be calm, because I think that's what, at least what I've read online, that's what most of the partners try to do, is just stay calm. But that part of me had really nothing to say. I mean, I had done all the research and I knew what was kind of coming.
But you could tell that I was in no place to listen to.
No, that doesn't help at that point. So I kind of stood there and I just came over and took his arm so that we could get him home. And so this is the episode we wish someone had given us 3 years ago. Not a how-to, not a story of how everything's going to be fine and you're going to recover and you'll get your, incontinence won't last forever and it'll only take this many weeks or this many months, but rather not a how-to, but a story. So you're not alone in whatever version of this you're sitting in right now. I think some of the discouraging parts of this have been, well, for me, it only took 2 weeks, and and him talking to some guy who was out on his bike after 4 weeks after prostate surgery. Yeah. So you just have to be very, very careful not to make somebody else's story your own. And I think what this episode is trying to do is give you permission for whatever it is you're going through, that it's your story.
Mm-hmm. Next week, we'll do an episode that's about you, the listener, and what we've learned about a path forward. This one is just about us, and it's
pretty honest and raw
as we can get.
Yeah.
So I had a radical prostatectomy it's almost 4 years ago now, and we've talked about it a little in previous episodes. I had stage 2 prostate cancer, a moderately aggressive kind. And I caught it earlier than the statistics would have predicted, but that's because we pushed for it. Mm-hmm. And I now coach men through the recovery stage I had to figure out mostly on my own.
I'm definitely not a clinician. I mean, one of the least kinds of careers that I ever considered was being a nurse. But when someone is faced with this kind of a diagnosis, you become the partner who goes through everything with them, and you become the person who spends a lot of time looking for resources. And in this case, I was looking for resources that really didn't exist.
There were no resources for you
and I was never asked by a doctor, is there anything you need to help you support your partner? Like I was never really even included in the process, particularly right after in the hospital, where which obviously we won't be doing it again, but obviously I would never have left him. Like I would have stayed all night in the hospital with him. I would never have left. And I was kind of pushed out. And I really, I actually
it was pretty close to COVID. So
I actually really resented that. So that's just a little piece from me.
Mm-hmm. The thing that I want to name about the diagnosis stage briefly is this. My PSA was 3.2 when we first started pushing for further testing. That number is statistically reassuring. It's the 4.0. That's the red flag. Most clinicians would have told me to come back in a year. In fact, one of my urologists did. We pushed anyway because something didn't feel right. And that advocacy is the first thing I would tell any man listening to this, or any spouse or partner of a man.
Yeah. And I mean, in your first kind of, before you had, like when we were trying to get a biopsy, I was in the car on the phone because it was COVID. And I was saying, no, we're not settling for, because she was kind of like, at that point, she was waffling. And at that point, I said, we're not settling. We have to have a biopsy. This is not normal.
Well, and my lab test hadn't been entered into her records when it had switched to 4.
Yeah.
So I had to produce that.
Yeah. And even 4 is not considered a big deal.
No.
So
if you have a sense that something is off, you are allowed to push for more information. That conversation is harder than it should be, lots of pushback, and you may have to ask more than twice.
And the waiting between the first elevated PSA and the biopsy was really hard, and harder than I even let on, because we were just trying to be, we had to get through Christmas. And we weren't telling our kids where things were at that point, because we just wanted to get through Christmas. And at that point, we didn't even know if that was going to be your last Christmas ever. Mm-hmm. And so we were just trying to get through things. And I was Googling things. And I would say, like, I called the Canadian Cancer Society, and they were less than helpful. Like, they don't really know anything up to date. They're just a bunch of volunteers.
Which is fine. They're kind, but...
nobody was mean.
But I even found the information was out of date.
It was way out of date. And so I was running numbers and trying to figure out, what are the 5-year survival rates? What are our chances? What should we be thinking? What should I be prepared for? And this is the kind of fear that a partner carries in that stage. And there's nowhere for it to land. Mm-hmm. Because if you express it, you scare the person whose body is now the one in question. And really, honestly, unless other people didn't ever ask me or let me just sit there and be sad, like there was nobody that, because to be honest, everybody's scared. Everybody's terrified of cancer. We kept the circle small, but everyone is terrified of cancer, and they don't want to talk about it. We kept the circle small
deliberately. We had literally 12 people that we told, so that we didn't have more than 12 people checking in.
No,
because that.
But it was difficult for even those 12 people to check in, and people just want to be, it's going to be okay, and things are positive. But I think they forget the side of you, and that's something I've learned for somebody. If I'm in a position where somebody I know is kind of going through something like this, I would say, hey, I know how scary this is. I'm in your corner, and what do you need right now from me?
I want to be specific about, so there is the aftermath that nobody warned us about. And I want to be specific about what aftermath means here. because I think the word does a lot of work that hides what's actually happening. The anesthesia wore off, the catheter eventually comes out, you go home, you're alive and you're cancer-free, and you're not yourself. You're not in a poetic way, but in a really concrete way. You don't trust your body to do basic things. You're monitoring constantly. You're afraid to cough in public. You're afraid of laughing too hard at dinner. The version of you who walked into the hospital is gone for now. And the version who came out is someone you don't recognize yet.
And so I noticed the change immediately because, you know, Charles is pretty a confident person, and he obviously carried himself very differently within days of the surgery. There was a lot of fear. There was a lot of flinching at small things and constantly checking himself and just being quiet in ways that he never had before. And my own experience at that stage, because I think this is the piece that partners are not really allowed to say out loud, is that you're grieving. You're grieving the person that you had been married to had been replaced by someone who looked the same but was just moving through the world very differently. And I think we forget that cancer, like there's a lot of life-altering things, and we've been through almost all of them in our lives.
Big moves,
job loss.
Sudden deaths of family members.
Yeah, job loss. Like all kinds of things that are, but there is nothing, I don't think, that compares to a cancer diagnosis and a treatment. Your whole world shifts. And I knew I was supposed to be grateful for the cancer-free part, and we definitely are. We continue to be. I mean, we still have, every time the blood work is taken, and we're, you know, there's that, you know, holding of breath for a moment, knowing that a whole process could start again if this things shift inside your body. But you're also I was losing my husband as I had known him, at least for like a pretty long stretch. And I had no real permission anywhere to feel that, because
and I mean, I would try.
If I would have said, well, I'm really grieving what I've lost, that's not also, you know, helpful in his recovery, because now,
well, then I would shoulder blame for
what. So it's just, and there's no shame and there's no guilt in having this happen. But I also think there's a lot of things online, like about people who don't have the surgery. And I think a lot of reasons people don't have the surgery is honestly because of some of the things we're going to talk about in the next little bit in this podcast.
Yeah. The hardest part of the first few months was not the leakage itself. It was what I started telling myself about the leakage, that I should be further along, like the guy who went and played tennis and at week 6. And, you know, some guys say they're dry as soon as the catheter comes out. And the averages, the statistics said that I should have been drier by then. And I thought, well, maybe I hadn't done enough physical training going in before the surgery. And that made me feel shame. And so all of that compounded faster than the physical recovery. And the shame made the physical recovery even slower.
And it changed our sex life immediately, not because either of us made any kind of a decision about it. I mean, we knew it going in. Yeah. We were honest with ourselves about that. But also because his body just became unpredictable, and I couldn't predict him, and there was like this kind of careful silence between us at times, and a lot of tearful conversations about, you know, I don't have those kinds of expectations. I just want to be close to you. I just want to hold you. I don't have an expectation about
But I'm
things.
Feeling like I'm not a man anymore, and I'm not.
And that explains why a lot of people refuse the surgery.
Yes. And the thing is,
to their own detriment.
Because of the work we've done in our marriage, we do have conversations, and we did have the tearful ones and the solemn ones. But a lot of couples, you might be one of those couples where it goes silent and it stays silent despite the need for any type of conversation. And so here's an honest accounting of what the system This is Ontario healthcare. It'll be different in every country and province, and depending on insurance providers in the States, like everything's a little different. But our system gave us in the year after surgery. So I was referred to a urologist for the predictable erectile dysfunction. And that referral was fast, and the conversation was clinical, which is appropriate. But it was just the entire conversation. There was a prescription, a follow-up in 6 weeks, and that was it. I eventually was referred to a pelvic floor physiotherapist for the incontinence. And that referral came later than it should have by admission of our urologist. I was using more pads than I needed to for months because I didn't know better. And the first physiotherapist demonstrated how to do Kegels, kinda.
Yeah. She was very harsh.
And had me doing exercises and weigh the amount of urine in the pads after every workout. There was progress, but there was a lot of emotional turmoil not addressed. And I have my own baggage around physical training and fitness. So there was a whole
she was
layer
super
of shame.
fit, and that was her thing.
She was muscle from toe to head.
And she was also very harsh. And so I would really warn anyone against going in for any kind of treatment or counseling or anything that is harsh. And that doesn't mean it can't be kind. Like, it needs to be kindness. Doesn't mean that you don't set goals and people aren't like honest.
No,
this wasn't honest. This was just, do this. Come on, do this. You've got to get this. You can, like.
Imagine a trainer at the gym who's trying to make you do 10 more push-ups at the end of a set. Like, there was that type of pressure, which
it was too much.
Way too much. And if you're a lot of guys like that type of pushing, and they think that, getting yelled at and things counted at them, and the hoorah marine kind of stuff. You think that you can handle that when you're in this vulnerable spot. It really doesn't hit or doesn't land well.
It's very sad. Yeah. So our surgeon, Charles's surgeon, has consistently asked about Charles's mental health at every follow-up, mostly because I usually say something. Well, I just want you to know that this is what's happening, la la la.
Yeah.
And it's worth saying that he didn't poo-poo it.
No, and he admits that it's not their forte as urologists and surgeons.
Straight about that. Yeah. But the younger residents who sometimes did the follow-ups, never. And even when the question got asked, it was just how are you doing emotionally? And it didn't go anywhere. And there's no referral, and there's nothing to sort of say, well, here's someplace you could go. So,
if you meet men in support groups or online forums, some doctors are very quick to start prescribing antidepressants, which compounds the problem because it's not a brain chemical imbalance. No. It is an emotional upheaval and
it's a natural thing to have happened because your whole nervous system has been disrupted. So patients need to go beyond the purely physical, and the way their emotional needs are met really sets the tone for that recovery. And it doesn't happen in Ontario. No. Like, there were vague attempts at it, but it's actually crappy.
Yeah. The place where this is done the best is in most of Australian hospitals.
Yeah.
The villain in this story is not any individual clinician. It's a structural gap. Once the cancer is treated, the system considers you a success story, and the rest of recovery, the part that affects identity, intimacy, confidence, and marriage, is largely yours to figure out. The research on this is consistent. Incontinence and ED are named in study after study as the most distressing long-term effects of prostate cancer treatment, and the psychosocial support to navigate them is named just as consistently as the most inadequate part of survivorship care. You're lucky if you get a nurse practitioner calling you 2 or 3 times after the surgery.
Which didn't happen to us. No. We had nothing. And for partners, the gap is even worse. When women experience breast cancer, there's at least a recognized community of other women who've been through it. Men with prostate cancer rarely have that. And I don't think that like men think, well, if I avoid the surgery, then I'll still be okay. But yet radiation and hormone treatment has,
impacts
ED and incontinence. We don't know how, eventually too. So men with prostate cancer definitely don't have the support, and women are just different. We bond differently. So partners of men with prostate cancer, almost like
there's a
huge gap. I've not been asked how I'm doing more than, I don't even think I've been asked a hand, less than, in the entire progress. And I want to say this to the partners listening: that pattern is not your imagination. Nobody is going to ask, like not even really your closest friends. You're going to have to make a place to land for yourself.
Yeah. And I just wanted to add that for gay men or bi men with male partners, there's a whole nother layer that's even kind of worse, because in the hospital system, they treat prostate cancer men and spouses as heteronormative. You're always talked about, your wife and the whole, if there are any conversations about post-operative care and expectations of lifestyle and whatever, it's very heteronormative. And so if you are a gay man, you and your partner will feel even less supported, and there's even fewer places for the partners to go. I want to describe a specific dynamic that I think a lot of couples in this situation will recognize. It's the part of the story that I find hardest to talk about, but I think it's the part that's the most worth telling. Within a few months of the surgery, Pam and I had developed a kind of mutual carefulness. I was protecting her from how discouraged I was, and she was protecting me from how much she missed our old life. Neither of us was lying, and we just weren't saying the things that mattered most.
I was like softening my own needs. I wasn't bringing up intimacy because I didn't want to add pressure. He was going to work. There was a lot of pressure there that was, pretty awful. And it wasn't a great place to work. And so I wasn't, bringing up my own grief because I didn't want him to make him feel like he was failing me. I just thought in my heart I was being generous. And then looking back, I think I was losing access to my own voice, as well as not talking about the things that were important to talk about at the time, even though it was really, 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 really hard. And I mean, since then we have.
Yeah. And we thought we were doing all right, but I think we noticed the gaps later on. The thing that I want to name about that period, because I didn't see it at the time, is that both of us being careful was its own problem. We weren't drifting because we didn't love each other. I don't really think we were drifting, but we were both holding back and being careful.
It was just really, 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 really hard. And there was no place to kind of go to say that, for me to say, I can't, I'm having such a hard time with this. There was no place for me to really say that.
Right. And some couples talk about a deep sense of distance setting in, and we didn't
allow that to happen.
We kept on working.
But socially, both of us were alone in different ways. Charles had no other man in his life who had been through this, or at least none who would talk about it. And I had no other woman in mind. Friends and family don't know what to ask. And they ask once about the cancer, hear that the cancer's gone, and then they assume the story is over, and the story is not over when the cancer is gone. The story is in some ways just beginning in a different way. It just changes shape.
Already at that point, I didn't know that I would be coaching men, but I was already pretty TMI in conversations with guys when I was alone. They would sometimes say, "Hi, how's it going? How's recovery?" And I would just say right out, "Oh, at 5:00, if I cough, I still pee myself," or, I haven't had any erections in a year and a half. And they were just shocked and didn't know what to do about it. So they have no response either. But mostly I did it because I just wanted them to start getting their PSA checked and to start being like, I was just a public service announcement, on legs, just trying to get guys to pay attention to their bodies and do something early. So I thought I would use shock value, and it worked in some cases, I think. All right. So, and then things did start to shift, and I want to be specific that not one thing was the answer. The first turn was a second pelvic floor physiotherapist. The first one had given me exercises. The second one interviewed me. She asked me about what I was telling myself when leaks happened. She corrected my Kegel technique, which I had been doing wrong for months. And she referred me to a naturopath who supported with nerve recovery and reduced inflammation. And none of that was the answer on its own, but the quality of attention was different from what I'd had before, and that really mattered.
It was kind. Not like just being nice and letting everything go, but it was kind.
Yes.
And the other just felt cruel and unusual and inhumane.
And she introduced me, which we'll talk about probably more the next episode, to the concept of mind bladder connection. Like there's mind gut, but there's also mind bladder.
Absolutely.
And so there was a whole different level of support through her.
And around the same time, I was reading books for this podcast on the nervous system, on regulation, on somatic practice, and the relationship between the body and breath. And I want to be careful here because there is a wellness industry around the vagus nerve right now, and a lot of what gets sold is way over claim. Like way over claim.
Yes.
Like you can't do this and solve your problems. What I found in the more serious literature was simpler and more useful practices that help the body downshift from this constant vigilance briefly with short repetitions. So I started doing things and I
started watching. Yeah. I started experimenting with these two, and the thing I want to be honest about is this: at first they didn't seem to do much. There was no breakthrough moment like what was promised. What there was, though, over a period of months was a slow shift in how I related to my own body. The hypervigilant monitoring loosened by a small fraction. The bracing in my pelvic floor softened by a small fraction, but more importantly, I became aware of every time I was over-bracing. And those small fractions started compounding. The phrase that eventually landed for me and that I find myself coming back to over and over is this: control improves when you stop trying to control. And that sentence took me about 8 months to believe, and it is now the foundation of how I work.
And what I wanted to kind of emphasize there is that only happens through some kind of support.
Yeah.
And you actually got a coach at that point, and that really moved things along. Like the actual coaching did help.
Yeah.
So, and then we also started talking again, and not all at once and not in some grand moment. We just started small. We had a weekly check-in with some structure to it, a kind of short ritual of physical closeness that was explicitly not about arousal. So neither of us, there was no performance attached to it, and a communication script for the hardest conversations. And over time, just that careful silence just started to get smaller. And then what was our more normal relationship began to come back. And I actually felt like it was okay for me, like, to be sad or upset or whatever again, rather than, and for me to say things that I actually knew might upset you, even though I knew that they needed to be said, like out of kindness, saying some
And I
things.
got to the point where I could accept them and not take them personally and not be shamed. And I could open up and be vulnerable about some of the toxic thoughts that I was rehearsing in my head that were not helping either. And so the integration is really what worked. Better physiotherapy plus nervous system practices plus working with the parts of myself that had been on duty too long plus the relational work with Pam Pull any one of these out of the mix and the recovery would have stalled. The whole stack is really what shifted things. So why this became a coaching business, I want to explain how I went from a man recovering to a man building a business, because I think the honest version of that matters. About a year in, I started realizing that I had assembled a kind of map of this terrain that other men didn't have. I had walked through the medical lane, the physiotherapy lane, the somatic lane, the nervous system lane, the parts work, and the relational lane, and I had figured out that they actually fit together. So it's not a credential. I don't have a coaching certificate or a degree. There isn't one out there. It's not the same as being a urologist or a physiotherapist or a mental health therapist. It's something different. It's a guide that has walked the road and who knows where the path forks and where the false summits are. And I kept hearing from other men, sometimes friends of friends, that they were stuck in places I had been stuck. Same questions, same shame loops, same sense of being abandoned by the system once the surgery was done. And I started having conversations with a few of them informally, and they were finding the same things useful that I had. And it even expanded into men struggling with erectile dysfunction that had nothing to do with prostate cancer. But
yeah,
my conversations with them were starting to shift things for them as well.
And then I started thinking about partners, about how isolated I had been, about how almost everything written for partners of prostate cancer patients positions them as patient supporters whose own grief and sexuality is on pause until the patient recovers. And I wanted there to be something for partners that took them seriously as people whose lives have also changed.
So we've built Rise and Restore Coaching. It's not medical care and it's not physiotherapy. It's a structured coaching program for men in the first 1 to 2 years after a prostatectomy and for couples doing this work together. We'll talk in detail in 2 weeks about what it actually looks like from the inside, because that episode will be about you and not us.
And I think also it's good to say that it's not even just for men who after 2 years,
right. Because actually, for me, I've had to continue practicing this, and
I think it's for any men kind of struggling with their sexuality or their relationship, and because it has an impact on how your body functions if you're struggling, and if you need some coaching on how to take a step back and kind of rethink everything. And I think that's mostly what Rise and Restore is. You're here, you're low, you need to take a step back and rethink how how you're doing everything, and how you're working so much effort to try to do it, to be able to be the person you were before, when in fact what you need to do is rise and restore yourself to the healthy person that you are today, anew.
Yeah.
So,
and I mean, you didn't get your same husband back, but
I got a better version. To be honest,
I don't know if it's better, but
it's a better version because you're more.
It's improved.
No, it's a better version because you're more in touch with yourself, and you think about how you're feeling and reacting, and it's a better version of yourself.
Well, and
you have strategies to cope with some of the stuff.
And actually, a lot of the learning has helped me respond differently to you when you're in grief or when you're in anxiety.
Because naturally, when you're a loving couple, you want to fix things for the other person, and you can't fix this for somebody else.
No.
That's the lesson of life. Mm-hmm. You can't fix somebody else.
No, exactly.
And this coaching allows you to, become a better version of yourself, which and live your best life, which is the whole point of No Room for Phonies. If anything in this episode has landed, the best thing you can do right now is send it to someone you know who needs to hear it. Most men in this situation are not searching for help. They are waiting for someone to hand them permission to look.
Next week's episode is the one where we'll shift the conversation to your story. If you're a man who's been through a prostatectomy or if you're a partner of one, that episode is built for you. The 2 hidden problems that almost nobody names, what actually helps and what doesn't. What working with us looks like and what it doesn't. So subscribe so you don't miss it. And thank you for sitting with us today.
Yeah, this is a heavier topic, but we're so excited that we're going to be able to put this out there in the world and make someone else's experience different. And even if you're 5 years out from your prostatectomy, I still think even if you're just suffering from ED or your relationship has gone down somehow in intimacy, I think this coaching model could really make a difference in your life.
And if you know young men between 30 and 50, there will be a whole bunch of resources for them to monitor their health and what they can do to lower the risk of prostate cancer or other maybe benign prostate problems. Half of the men in the world over 50 have benign problems, and many of them are avoidable with choices you make in your 30s and 40s. So thanks for joining us. Lots to think about in this episode. And next week, it's just going to be all about you and how we can support you in your journey. So thanks for joining us and in this introduction to our story about Rise and Restore on No Room for Phonies. Good night.